Let's talk about the treatments that you did have. You mentioned
Okay.
about the surgery then.
Yes.
Lumpectomy, I think you
Yes,
said.
I did.
How did that go?
The op was fine. I was very sort of scared because I'm not very good with needles and things anyway, but I'm a lot better now, having gone through this. The surgery was very quick. I was in the hospital for a day, literally, stayed overnight, had a drain in and went home the next morning and felt fine, really did, not in too much pain. I was given painkillers and went home, and I was uncomfortable. The sleeping, I think, was the worst bit, knowing how to sleep, and supporting this right arm. But I didn't really have any problems initially. It was fine.
And then you had later treatment as well. What was the next step?
I did. The next step was, I think it was after 3 weeks that I started on my chemotherapy. And having seen the breast care nurses and the doctors at Glenfield, they actually asked me if I had, can I say this, private health insurance, which I did have, I hadn't used. And they said, well, if you have, you could probably use it for your chemo because it will probably just be a slightly nicer experience at the Spires Hospital. So I said okay and followed that through, and I did in fact see the same oncologist, and he said that would be fine, he'd just treat me at the Spires. So I started I think it was 3 weeks after I'd had the surgery, at the Spires for my very first chemo. In the meantime, I'd had an infection in the scar, which had necessitated me having a course of antibiotics. And at one point, they thought that might delay the chemo, but thankfully it didn't. So I started my chemo on the 3rd of May. And I was petrified. I really was. I was dreading the needle and the cannula and all the rest of it. But the nurses again were so lovely. You know, they used all the things like warming your hand, and they were just great. And so I didn't look for that first treatment at anything really that they did. And it wasn't as bad as I thought.
What did you think of the environment there at the Spire? Because we haven't had many patients who've accessed that.
Right. I thought it was well, pleasant. I had my own little room, so I could have my eldest daughter wanted to come to every treatment, which she did. My brother also wanted to be with me, and my father, and also another friend of mine called in every Thursday when I went. So that was nice that I could have people with me, and literally people dropped in, which they allowed.
And were there other patients there at the same time?
There were in different cubicles, yes. There were lots of patients. Probably the downside of that was that I didn't really get to know any of the other patients.
That's what I was wondering, actually.
Which I understand from a friend of mine. She did get quite close to 2 ladies at the Royal Infirmary when she had her treatment a few years ago. But as I'd got these 2 friends, of course, I did actually talk to them in a lot of detail as well. So I thought the treatment and the environment at the Spires was good. Yeah.
So how did you find you tolerated the chemotherapy overall?
Overall, I think that the chemotherapy was tolerable for me. I had sort of steroid backup and all the anti-sickness drugs, which again I did use initially and was prepared to, but I didn't actually find that I felt sick and nauseous very much at all. The biggest problem for me was the depression, because by this time I was so depressed, and when I'm depressed, unfortunately, my body shuts down, and that's how I felt that I was shutting down. And I mean, I have got an insight into that now, very much so, and that's what was happening to me.